Hey everybody, Scott Everitt here, Practical Data Solutions, and I wanted to talk to you today about an opportunity or visit potential dashboard that we've been utilizing with a lot of our clients and finding really great results with this. What we're really trying to do with this particular dashboard is ask the question, what if? It's kind of a predictive analytics type thing, and I hope this is something that would be useful for you to look at. So obviously patient access is really a key right now with most practices. And a lot of times providers want to look at how quickly can I get patients in? How many more visits could I schedule? Things like that that really drive, our availability to get patients in, which drives our patient experience. And so what we want to do is we really want to look at all of our providers and we want to see who are our providers who are performing particularly well in certain areas, who are the providers that are maybe a little bit below average or below an internal benchmark, and then ask the question, well, what could happen if we could bring those providers who are below average up to the department average? And so what we looked at here are things like session visits, number of visits that we could schedule per session. And so what we're going to start off with is leveraging what we know. We know what each provider does per how many visits they schedule per that time. Okay. Well, if you look at the chart that is right now in the upper left-hand side of things, we can see what are the average clinic visits per session. You can see we've brought in a benchmark, which is just the internal average, and you can see obviously right away the providers who are performing above average, the ones who are scheduling 17, 18 patients per 4-hour session. Then we have our providers that are down below that are maybe only scheduling 6 to 8 patients per session. So we ask our question, what if? What would happen if? How many more visits could we bring in if those providers who are performing below average just moved up to the average for the department? And in cases like that, you can see it's reflected by the yellow and red stripy section of that chart. That's available capacity. We look at it and we understand that if we were able to bring those providers up, we could see an average of an additional 1,000 patients per year. That's a 1,000 patient visits per year increase just by focusing on those few providers coming up to the department average. We could look at it different ways too. We could say, well, maybe everybody has the opportunity to increase. So what would happen? What's the potential if everybody increased at 5%? Or we can understand, maybe the top performers can't improve a full 5%, but maybe our bottom performers could improve 20%. So you can start looking at things that way. But really, you can say, there's availability to improve for everybody even a little bit. And so what's the potential opportunity that comes from that? And again, you can see who are the providers that are giving us our greatest opportunity for increased visits by simply improving what they're currently doing. And then, of course, we wanted to bring in this great dumbbell chart. And the dumbbell chart really shows the range of opportunity by provider. So maybe the provider can't necessarily meet the highest opportunity that's out there, but maybe they can come up with some average. And if they met their average, well, here's the number of potential visits per year that would come from simply improving in a certain area, whether it's visits per session, whether it's number of sessions per year, anything like that that could improve the amount of capacity that each provider has. You can see the provider's range of how many more visits could come from simply improving a little bit of what they're currently doing. And so you can see the red mark indicates the average, and the two dumbbells really indicate kind of the range of opportunity that's out there by provider. Now, we talked about this from an increased visit standpoint, but if you look at the lower section, that's actually increased revenue that comes across from this. So obviously, if we're bringing in additional visits, that's going to have a financial impact to the practice as well. And so we can benchmark everything kind of similarly to say, if we know our revenue per visit, well, now we can start looking at the average potential per physician if everyone were performing at the department average. We're looking at $57,000 per physician that would come across. Or if we were at some external benchmark and each provider were performing at that level, there's an additional, say, 45,000 that would come across per physician. It's a great financial impact, which is really a compelling argument that you can utilize to motivate change. And then, of course, we can look at benchmark visits per session. We can start looking at that same dumbbell chart to show the range. What could we get from, improving just a little bit? And, is it something where we're looking at, a couple of $1,000s, or is it something that we're looking at tens of thousands of dollars? And so really utilizing this to highlight what is our opportunity or what is the potential that we have for improvement, it can really compel people to understand, one, how they're currently performing, two, how they probably could be performing, and three, what would really be the benefit to the practice or even to that provider personally if they were performing at that level. So this is a dashboard from PDS. If you have any questions on this dashboard or you'd like to see or hear a little bit more, please feel free to contact us. You can reach us through our website at pds-online.com. Look forward to speaking with you later.